Since the advent of the first generation of direct-acting antivirals some 3 years ago, what progress has been made in reducing barriers to wider use of HCV treatment?
Well, there have always been barriers to HCV treatment. What's interesting is we go back and look, those barriers were regimen related. They were injections of interferon once a week with a lot of side effects. In the era of telaprevir and bocephevir, it was a high pill burden, with bocephevir up to 17 pills a day, shots once a week, 48 weeks long, and lots of side effects, including severe anemia. So the barriers were all linked to this really hard treatment, or at least so we thought. And in fact, if you look in some healthcare systems like the VA, as many as 65% of U.S. veterans were deemed ineligible for those treatments. And the barriers had to do with contraindications to peg interferon, ribavirin, and things like that. Well, in late 2014, that regimen is gone. Many patients will be able to take interferon-free, ribavirin-free therapy with a simple one pill once a day, or perhaps several pills once a day, and few side effects. Now, if we remove interferon, remove ribavirin, what's that leave us with? Well, it leaves us with predictors of response. And that's the other piece of good news, is in the clinical trials, there were very few virologic failures. And about the only thing that comes out is cirrhosis of the liver. Those patients may need longer therapy in some cases. But a lot of the other barriers to cure, race, IL-28B genotype, other features are now no longer part of our discussion. So in my view, in the future, it's going to be about access to treatment. Is the patient diagnosed? Are they referred to appropriate specialists? Does someone agree to cover the cost of the regimen? And once prescribed the regimen, do they take it? For most patients, it'll be 84 consecutive days of antiviral therapy. If they take that, they're going to have a 95% or higher chance of cure. So the challenges really become one of delivery of the medicines as opposed to the medicines themselves.